It's a funny thing, in New York, especially in this area, in the New York metropolitan area, everything is specialty driven because people have it in their brains and their minds that I have to go to a specialist, whether it's from peer pressure, my neighbor goes to a specialist, they go to the specialist, or just an understanding. Throughout the country as a whole, the majority of dentistry is done by general dentists. Every specialist is trained as a general dentist. That's where they start. Specialists go on to different training in a focused area. So there are 8 known specialties in dentistry. A general dentist is trained in every one of those areas. That being said, they may not like all those areas, or they may not be comfortable with pursuing work in certain areas, or they may not have had further training. I am a general dentist. I have pursued training in implant dentistry, and I've taught implant dentistry at NYU for a period of time. And I have trained beyond school to become expert in implant dental care. Implant dentistry, by the way, is not a specialty. It's just something that several specialties have taken on. So I am well trained to perform that. Not all general dentists are. I am well trained to do oral surgery of different types. So I extract teeth and I do different types of surgery because I pursued that training in many different ways, and I'm well trained. I'm well trained in terms of doing aesthetic dental work and in doing crowns and bridges and root canals. And all of these overlap different specialties. So the way I view it with my training and what I pursued and the way that I work in my practice is that I'm the quarterback. I'm the center, the hub of the wheel. And when a patient comes in, I will take responsibility for all of their care. And I know what I am either not qualified to do because I don't like to do it, or I haven't pursued more training to do it. And that's where I personally will use a specialist. And like I've mentioned, there are areas that I've really pursued and that I am expert in. And so that I will do implants all day long, but when there are implant cases that go beyond what I should be doing or what I want to do, I will use either a periodontist or an oral surgeon to do that work. Now, every general dentist is different, so someone going to a general dentist has to be aware of the level of training that their dentist has, the level of educational pursuit that their dentist has taken beyond where they were trained initially, and how much of what they are proposing to do. So when a person comes in to look beautiful again because their mouth they don't feel is aesthetic anymore, there is no specialty in aesthetic dentistry, but there are people who have pursued higher levels of education in aesthetic dentistry. So the patient has to, there's no specialty to look for, but the patient has to ask their dentist, can you show me some pictures of what you've done? Can you let me know how many of these techniques you've done before? Don't be afraid to ask that question. The patient is the patient, and they should not feel funny asking their doctor, and their doctor should not be offended in answering such a question. And that's how I look at it. So the general dentist is the quarterback, capable of doing a wide range of treatments, but really that general dentist will, quote unquote, specialize or pursue certain areas of which they are most comfortable and most skilled at. And the other procedures that go beyond that will refer to doctors who are extremely well trained. Dentistry is amazing. Oral surgeons are amazing, amazing practitioners. I would trust an oral surgeon over many physicians in anything dealing with the head and neck area because of their training. Endodontists, root canal specialists might be a scary thing, but they do this all day long, every day of the week and every week of the year. And they are best trained for complications and difficulties with those types of problems, as periodontists are highly skilled and amazing amounts of work that can be done.